a membership or anything, but you can go in, and I'll pull up some tomorrow in lab so we can all listen to them together. But you can kind of go in and see about those bronchodesicular, or testicular lung sounds and what they should sound like. Okay? All right, now, there are a couple of disease processes with respiratory that I do need to make sure that you are aware of. This one specifically because you will encounter it in the long-term care facilities for the reasons that I stated at the beginning of class. Okay? So what is COPD?
Chronic obstruction pulmonary disease.
I can read a book, but what does that mean? What does chronic obstructive pulmonary disease mean?
They don't have the elasticity in their areolas to expand and exchange oxygen.
Which impedes what?
Proper exchange of oxygenation.
Yeah, physiologically speaking, they don't have the capability to adequately exchange oxygen for CO2 and back and forth, okay? Now, there are two general problems associated with COPD. Emphysema. Anybody know the other one?
Bronchitis.
Chronic bronchitis, okay, where that bronchi is continuously inflamed, okay? Now, the number one cause for COPD?
Smoking.
Smoking. Whether it's tobacco, Mary Jane, cocaine, anything, okay?
Every time you say that,
I think of Last Dance with Mary Jane by, what's the name of that? Tom Petty and the Heartbreakers, yes.
I'm thinking of Friday.
Rest in
Sorry.
peace. Friday.
Okay, I'm just sorry, no.
What you doing over there, Smokey? If you have not seen Friday, you would, I could tell, because you would be dying right now, okay?
Yeah.
All right, assessment findings, they're typically going to have a lower SpO2, probably a higher respiratory rate, heart rate, that more than likely will be on some supplemental oxygen, or they might be practicing a thing called pursed lip breathing. Have you guys heard of this before? They are breathing, and when they exhale, they're breathing through pursed lips like they're blowing out candles. Okay, I apologize to those of you in the front row. I had coffee this morning. But what that does is it puts back pressure on the lungs themselves and helps to cause those alveoli to open up a little bit more. Okay, so it's called a PEEP, basically, positive end expiratory pressure. All right. Now, some interventions for patients with COPD, of course, are going. The book specified cigarette smoking cessation, but just smoking cessation. Should probably change that to just cessation of smoking. Okay. Oxygen, supplemental oxygen, if they are chronically hypoxic. Okay. Yes, earlier I did say that we want to limit that to, for patients with COPD, but they could utilize it. Okay, if they are having a really hard time catching their breath, where it's interfering with their ability to perform ADLs independently, then we can give them some supplemental oxygen. Oxygen is considered what? A medication. So what do you need before you can get it? An order or a prescription. Okay. Now, push come to shove, if it's an emergency and the patient's really having a hard time breathing, we can put oxygen on them, okay, and get the order after the fact. But be careful with that and make sure that you get that order. CYA. Cover your assets. All right, PFTs. Anybody know what a PFT is? Pulmonary function test, to see what their capacity is for their lungs. Okay, any people here? I know I have one student who has asthma. Anybody else? Okay, what was that little thing that they gave you? Yeah, when you feel like you're having a
purple thing.
I don't know. No, that's Advair discus. That's medication. But they usually have what's called a peak flow meter, where they had you blow out to see how much capacity you have within your lungs. And if you notice a decrease